Welcome back to Product and Health Tech, a community for health tech product leaders by product leaders. I'm Morgan Stevenson, Director of Client Success at Vynyl. Today, I sat down with Scott Martin, founder and CEO at Rescription. We discussed how they are pioneering an innovative prescription drug solution to provide clarity, simplicity, and improved outcomes to patients. Let's jump into the conversation. Hi, Scott. Thanks for joining us today at Product and Health Tech.
Thanks, Morgan. It's great to see you, and I'm really looking forward to it.
Tell us your story and a little background on how you got to your position today.
This is Rescription is the fourth company that I've launched in healthcare after 3 successful exits. The most recent company prior to this, I sold just over a year and a half ago, called Remedy Analytics, which was directly in the prescription drug space as well, but more from the component of optimizing the broken system that we're all stuck with currently, which is through the PBMs, the prescription benefit managers, and optimizing that program for the employers in the country. And what we started to realize over time was that we were creating a blueprint for actually creating the first of its kind alternative system. So that's what Rescription is. And we launched just over a year ago, about the same time that I exited the last company. And, that's how I got to where we are today. But I've been in healthcare my whole career.
There's so much to build and solve for in healthcare. You mentioned optimizing within a broken system. How is Rescription replacing the typical PBM?
If I step back to, my career as a whole, you start to realize when you are in one space and focus on that space every day, you know it at a pretty high level. And the problem with healthcare and insurance in general, and really the whole spectrum of healthcare is it's broken by design from the status quo. And there are so many entrenched levels of conflicts of interest that control the system that it's very hard to make changes. And you need to really understand how the pieces come together, who are those conflicts of interest. And when you have an idea of doing something better or more efficiently, you need to understand all those moving parts to really be able to do it. And so when we look at what we're doing with Rescription, which is taking on, the titans of the industry, the PBMs and the insurance carriers, we realize that the only way to do it, in our humble opinion, is that you need to replace the entire PBM program. So what we see in the market today are a number of companies that are out there performing what we call point solutions, where they're remaking or reworking or creating a new way of doing one component of the prescription drug program. And the problem with that is that you can't replace anything with that one component, and the status quo won't work with you and partner with you. So our model is to come in and replace the whole system from A to Z, from the least expensive drug to the most expensive drug, which creates a little bit more of a challenge, but the end result is actually possible, but then at the same time, a much more effective solution overall.
You make it sound so simple, but in terms of untangling some of those conflicts of interest that control the inherently broken system, from an industry and both a product perspective, how exactly does Rescription provide an alternative solution to these PBMs, and exactly what benefits does this offer to employers and employees?
Yeah, so we have the luxury of this history, not only my history, but this unique team of leaders that I've brought in and helped to create Rescription with. And at the end of the day, in order to make these changes, you need to know what needs to be fixed and how to fix it. And so the first thing that we did was to realize that there are certain entities that are aligned with the end user and the end result we want. For example, disproportionate share health systems. state to state. So the first part of the program that we created was the realization and the process for partnering with these disproportionate share health systems. And all that means to be a disproportionate share health system, which just over half the health systems in the country are disproportionate share, is that they treat the indigent on an inpatient basis. And those are the systems that have access to unique and special pricing on the prescription side. And so in partnering with them, we're able to harness that in the right way so that the patient ends up winning with the lowest cost for the prescription drug. But the way that we're doing this is looking at each component and deciding, is that something that we need to recreate, that we need to build, that we need to restructure, or is it something that an independent entity has already done it in a super successful way where the technology is state of the art, they have a track record, the deliverable is there. And so in those situations, we partner with those entities. And we've got just over 28 partners currently where we've decided it doesn't make sense to build that. And then we've built where we've needed to build. And there's really our whole program is targeted towards employers. So if you look at a health system, they're obviously also an employer. So the health system is that unique relationship where they're a partner in that state to deliver the solution to the employers, the better prescription program with the lower costs and the clarity. And then by default, they win because we also put it in place for their own employees. So they benefit both ways. They're saving on their own employees, but then they're also generating revenue every time we sign up an employer because they're our partner. And that's how they get paid for providing the components of the services that they provide. And that's how we get paid for providing the components and the items that we provide and service.
You mentioned having launched over a year ago. What is an example of an employer or a patient winning in terms of purchasing prescriptions?
So the end result is a net 30 to 50% savings. And again, it's on every prescription that's out there. The real focus on top of that is what people refer to as specialty drugs. We call them high-cost drugs. There's about 500 of them that we have in our program. And the unique aspect of how we're solving that component is by leveraging the pricing that the health system has. And in doing that, a member will get their prescription. It will come into our application, and they'll be able to see the information about the drug. And so, for example, one of these high-cost drugs could be $25,000, and they would see that their out-of-pocket is $2,000. And they can go ahead and get that drug today and pay that high cost. But the difference with our program is we're going to give them an option B right there on the platform, and they're going to see that if they go through these 3 steps, which I'll explain in a second, they will be able to get the prescription at zero cost. So they're able to make an informed decision on, am I willing to go through these 3 steps, which include a telemed visit with a specialist at our health system partner, which is part of the high-cost drug review. So that's one step. And then we handle the other steps. We automatically upload the patient's EMR so the doctor can make an informed decision. We have patent pending technology that allows us to adjudicate the claim only after all of the compliance steps for this medication have been checked and accounted for. And then the prescription goes through the system, through the health plan, and the member can either pick it up at the health system, they can have it mailed to them, or they can pick it up at a kiosk at their office or locations in their geographic areas. So the member wins because they're paying nothing out of pocket on a prescription that they very easily would have paid $2,000 or more out of pocket. And the employer saves because they're paying the lion's share of the drugs on a daily basis universally. So they're reaping that 30 to 50% savings on the medication as well.
So if you're offloading two of the three steps for the user, that sounds like an outstanding user experience. But I'd love to learn and hear a little bit more about the customer roadmap or customer journey with Rescription, and how does an employer or a patient get into the Rescription ecosystem?
Yeah, so great question. So the employer gets into in order to create the ecosystem, we need that health system partner in the state. Once we have that, then we do an outreach to all the self-funded employers, which basically means employers with 1,000 employees and greater. And we reach out to all of them in the state to make them aware of this program. And if their employer decides to sign up for it, then all of a sudden all the members have access to our program. And again, it replaces their current PBM program. So the real key here is, looking at, okay, well, what would be the decision for an employer to do this? And a simple analogy is that every employer and employee in the country are buying their prescriptions today exactly like the following. If all of a sudden after work, any of us go to our supermarket and everything had changed from the night before, there's no more labels on anything, there's no more prices, and you put what you think you want in your cart and you check out and they say, that'll be $485 and there's a mysterious $120 rebate. We can't tell you any detail about it, take it or leave it, and you end up paying for it and walking out. That's how it has happened for the last 30 plus years in our country. And we're reversing that. We're changing it so that it's back to the simple transactions that happen in a supermarket. So we're able to go to the employer and say, what do you really know about your current PBM program? And the result is that the employer will tell you, all I really know is what I paid over a previous 12-month period. I know what, in the aggregate, we as an employer paid the PBM. I don't know any of the prices. I don't have an itemized bill. I have very little detail. And those are all the reasons that we can't stand our PBM program. And so we come in and say, well, we can change all that, reverting back like the supermarket. We have a price for every prescription. It's the lowest price for every prescription. There's no markup on any of the prescription drug prices. All of the games that the PBM play go away because of this radical clarity that we're creating. And we charge a simple per member per month fee to the employer. And that summarizes the simplicity of the program. So not only are they saving the 30 to 50%, but just as importantly, they have this clarity that they've never had before and black and white proof of the savings. So it really is remediating an entire system.
Yeah, it's very counter to the typical experience, which I think healthcare is probably the only industry where a consumer does not know the price of something that they're purchasing. So that's excellent. So Scott, aside from having vast experience in the healthcare industry, what strategies do you use to ensure that your companies and products remain both innovative and competitive in the market?
Because we're really creating an entirely new alternative prescription system. There is nobody that we know of that's out in the marketplace doing this. There's, as I mentioned earlier, a handful of smart people and companies that have point solutions. And the neat thing with that, it allows us to partner again with those entities. So, for example, somebody that may or may not be creating better prices for generic medications. If we identify that they in fact have lower prices, we're able to bring them into our system. Since we're agnostic, it's not about our generic drug versus somebody else's. It's about who has the least expensive generic drug that we can distribute to our members, who has the least expensive high cost drug, who has the best programs that are out there. And that enables us to be able to do that. So right now we're lucky enough to be the pioneers in this. And I assume like any group that's pioneering something, eventually you have followers. But the terrific thing is that our team has a long list of innovative, creative, meaningful solutions that can be part of this program. And I'll just mention one of them, because one of the things that we talk a lot about here in the beginning is the actual price of the drug and getting the drug at a lower price. But all you have to do is Google the problem of abandonment and non-adherence. And everybody's been to the pharmacy where you actually see the person, the pharmacist, going through the bin by last name, and it's prescription after prescription looking for your name. And at the end of the day, over 60% of those prescriptions are never picked up. They get filed back and restocked back with the pharmacy. And so why is that important? It's important because when you look at somebody that is suffering from an illness and they're either not picking up their medications or not taking them as they're supposed to, for example, take a diabetic patient. All of a sudden, we can see that they are not taking their medication and they've been in the emergency room twice a month for the last 6 months. Obviously, that's an expense to the member. It's not good for their health, and it's an expense to the employer. Our system has the ability, because of the fact that all of the prescriptions come into our application and all that visibility and communication is there, we're able to see that Tim Smith didn't pick up his prescription. It's been 4 days. Our white glove concierge team is able to reach out to Tim to find out, did he forget? Is there a side effect he didn't want to tell anybody? What is the reason? We're also able to reach out to the prescriber, because believe it or not, in the crazy PBM system that exists today, the prescriber doesn't even know that their patient didn't take the prescription. So we're notifying that prescriber and we're resolving it and measuring it. And again, that's a much bigger financial problem and outcomes problem than even the prices of the drug. And that's something we're going to be rolling out as we get into the second half of this year. And it's just one of a whole slew of items that we've come up with. And really it comes back to, the PBMs took something that was once simple and made it incredibly complex. And you only do that for nefarious reasons. We're bringing it back to the simplicity that it should have. And when you do that, the dominoes kind of lay down in front of you as far as all the unique opportunities that you can seize to continue to make it a better program. And to your point, a streamlined, user-friendly program, because just as important as getting the savings and the outcome is being able to say, wow, that was really effortless, and it was not a headache, and it wasn't a long process, and it wasn't frustrating. It was just the opposite. It was a great experience, and I would recommend it to the next patient.
Aside from simply lowering the cost of these prescriptions, Rescription has features that ameliorate the issue with medication adherence, which is obviously will result in better clinical outcomes. That's really outstanding. You make building a new alternative to a very ingrained system sound quite easy. What are some of the biggest challenges and opportunities that you've encountered in building Rescription?
Yeah, as I've told early on, our investors who are looking to you for security and a sense of comfort before they invest their money with you, which I take very seriously, I'm brutally honest with them that this is my fourth company, and it's like being a freshman all over again. And you would like to think that you learn from every mistake you've made in the past, but this is a roller coaster, and you're holding on by your fingernails a lot of times, and you need to be resilient. You need to get knocked down and get back up and dust yourself off. And when you put the team together, you think about that as well, because while this is what I've made my life about and what I thrive on, and I use fear as a motivator and all these things that make black and white sense to me, to a regular person or any other person, those things can be terrifying and things that they don't want to be around. And so it's important to find people that are part of your team that enjoy that as well, that thrive off of it and understand it and want that, because the last thing you want to do is convince somebody to join your team or convince somebody to invest in you that looks at things differently and doesn't see them the same way that you see them. And then the counter to that is once you find people that have those characteristics, the last thing you want is a group of yes people that are just agreeing with you. You want to be challenged. You want them to have to be able to bubble their ideas to the surface. You don't want to create that this for the same reason that I haven't worked at a large company in a long time, corporate type entity, is because of the red tape and the hierarchy and a lot of what I perceive as the negative things that hold a company back, the politics. And so I've gone out of my way and I've become better at it as time has gone on, where you really foster an environment where you're hiring super talented people. You're not micromanaging them. You're letting them do their thing. And you're letting these ideas bubble to the top and make sure that politics don't develop. And that gets harder as you get bigger. My last company was the biggest to date. And when I sold it, we had just over 60 employees. The exciting thing about Rescription is we have the opportunity to be 1,000 times bigger, not only from a people count, but from a revenue opportunity. And most importantly, the outcome to be able to, this mission of being able through health equity to create savings for the masses. And when I say the masses, the employees at all these employers, and that includes everybody. That's from low on the totem pole to high on the totem pole without discrimination. And we really are at a crossroad right now. Employers and employees cannot afford these expensive prescriptions, and even the what's considered the less expensive prescriptions. And if you look at the FDA pipeline, there are literally thousands of drugs on an exponential curve that fit these high cost categories that are in the pipeline and will be here soon. So this problem's not going away, and we humbly believe we have a solution for the prescription problem in our country. And interestingly enough, where we're bringing the prices down in this 30 to 50% brings us to the same price level as the other countries in the world. And that makes a lot of sense when you look at the fact that we're replacing the PBM and the fact that no other country has a PBM except the United States. So we're replacing the PBM and we're ending up with the same price that other countries are paying. You can kind of connect the dots there.
So, Scott, what do you think are the other important trends that are emerging in healthcare right now? Are there any interesting areas at the moment? Is anything oversaturated that you think could maybe be overlooked, focused on an underserved area?
Great question. The prescription area in itself is just a massive, massive market. And then obviously, if you look at medical healthcare as a whole, even on top of prescription, it's even a bigger component. And you're seeing tons of companies pop up with great ideas, great initiatives, smart people, and I applaud that. I think I would say, and I have said to younger folks that are nearing the end of college and looking for their career out of college, didn't go to college, looking for a career, to get into the healthcare space and to get into it on the side of companies that are bringing smart solutions, whether it's technology, whether it's a process, whether it's a smarter way of doing something, more efficient way of doing something. Healthcare needs it. I don't think any of us want the government to take over. We want to have the private sector solve it. But if the private sector doesn't solve it, it quite possibly could be something that government takes over down the road. And I personally think that would be a step backward. So my hope is that the private sector will continue to focus more and more on this, and that the younger generation, the hope for the future will jump in with both feet into the space. We just hired our intern, great young man by the name of Jake Baker, who went to Trinity College. He's about to graduate and we liked him so much from the internship, we convinced him to come on board with us. So that's a great example, I think, of how to continue to build towards these solutions.
Shout out to Jake Baker.
Yeah.
Excellent. Does Rescription work with any third-party technology vendors? Have you explored the options of building versus buying? And if so, what are some of the points that you use to evaluate these vendors and their products?
I know where my strengths are and where my weaknesses are, which is part of the comments I was making on the team earlier. So our Chief Technology Officer, John Zerden, actually knew about Vynyl prior, so that made it easier. But he was the one with his team that did the vetting and made the decision to partner with Vynyl on a number of different components of our technology build out. For example, on the claim adjudication side of what we do, it didn't make sense for us to start from scratch and try to build a better mousetrap. That's not where the problem is that we want to address. So luckily, because of our background, we know who had and has the best technology and who would be willing to white label it for us in an exclusive relationship. And so we did that. And there's over 38 examples right now of entities like that we've partnered with, leaving us the opportunity to focus on what's broken, the pricing, the process of going through the channels to get the right drug at the right price from the right location, and being able to put those components together, including abandonment and non-adherence, like I mentioned earlier.
And is there something that your team has shipped recently that you are particularly proud of at the moment?
Yes. So our first client is now just over 2 months old. We started the company a year and a half ago. Our CFO, Steve Morante, likes to say we've been building the plane as we've been flying it, which is pretty accurate. So in a quite frankly, a miraculously short period of time, we launched the company, built the team, built the technology, built our process, put our partners in place, and launched our first client, Newbridge, Bergen, Rutgers Health System in New Jersey. And we're now working on landing our first employer client, in addition to the employees of Bergen Newbridge in New Jersey. And they went live 1/1/24. And I'm happy to say that things are going so well and we've delivered on everything that we promised, that the client has already taken us into the county employees and the state employees on our behalf to add them as clients coming up this following January. We also got a verbal commitment from St. Luke's Health System in Idaho, the biggest health system in the state, which we're very excited about. We have a meeting on the 14th to go in and solidify all that. We already have a number of employers in Idaho, but the greater Boise area, that have invested in us and are going to come on board as clients 1/1/24. And we've got a number of other health systems, employers in other states lined up and ready to go. So that to date is our biggest achievement, getting up and running and having this momentum that we've created in a very difficult market and financial market, but also a very difficult industry to break into.
Yeah, that's an incredible achievement and definitely something that you and your team should be proud of. Well, Scott, it was really great chatting with you today and learning about the important work that you are doing at Rescription. For the people that are interested, how can they get in touch with you?
So they can find me on LinkedIn, and they can also reach out to me over email. It's simple. It's Scott, SCOTT, at Rescription, prescription, but it's take the P out, Rescription, and .com. And would love to hear from you and be happy to respond.
Great. Thank you so much.
Thanks, Morgan. I appreciate it.
Thank you so much for joining us. You can connect with us on LinkedIn, YouTube, or on our website, productandhealthtech.com. If you have ideas or suggestions on what you'd like to hear on a future episode, or if you'd like to be a guest, please shoot us an email at info@productandhealthtech.com.